No kei aku nui, kei aku rahi rarau mai ki tēnei wānanga. Welcome everyone to the Facebook Live panel discussion. We're here today to help you understand more about the vaccine and why it's important to get vaccinated. We're asking you all to pitch in and confront the COVID challenge head on and to support Super Saturday. Today, it's a nationwide event. I mihi ana ki ngā kaupapa katoa huri no I te motu. There are so many exciting things happening today, great events from all around the country. If you want to follow what's happening in your rohi, your area, head to Unite Against COVID website, click on the Super Saturday and then put in your region and you'll find a whole lot of stuff in there. He nui ngā kaupapa, there's so many fun things happening from vaccinations on the TSS Earnslaw, the steamer in Queenstown, to Hangi in Rotorua, Kore he utu, and of course the Vaxathon that kicks off at midday, streaming on Stuff, TV2, 3, Māori Television and Hahana. We know many people are hesitant and have questions they want answered before they get vaccinated, which is why we bring you this amazing panel of health experts. They're here to answer your pātai, your questions, and we'll do our very best to get through as many of them as we can. We have the super busy Dr Ashley Bloomfield here till 10, and then we're going to continue till 10:30 with the rest of our panel. So Dr Ashley Bloomfield, you may have seen him around before, but in case you haven't, as well as being New Zealand's Director General of Health, he has a clinical background in public health medicine, and his professional interest lies in non-communicable disease prevention. Dr. Siouxsie Wiles, another familiar kanohi. She's a microbiologist at the University of Auckland. She also works with spin-off cartoonist Toby Morris to make the science of the pandemic clear and understandable. And their mahi, the award-winning graphic series, is being used all around the world. Professor Nikki Turner is an academic professor, GP, medical director of the Immunisation Advisory Centre. Malo Lele, Dr. Vanisi Prescott. Vanisi works as a GP and urgent care doctor in Auckland. She has a passion for helping people and a special interest in the health of our rangatahi, our youth, and the Pasifika community. He nui ngā rārangi pātai. We have heaps of questions coming in already. So we'll do our best to get through to you. Engari ko te tuatahi, ka tuku te rākau kia kōrero kia koutou katoa. I'm going to hand it over to our panellists to tell us why you chose to get vaccinated, and a pineapple lump to those who can do it in less than 30 seconds. And I'm going to start with you, Siouxsie.
Well, the vaccines are amazing. You know, they protect us as individuals, but more importantly, they protect all of us. So there are people in our communities who can't be vaccinated. At the moment, that's our children, and not everyone is protected when they're vaccinated. So the more of us that get vaccinated, the better it is for everybody.
Dr. Bloomfield?
Well, if you'd asked me this time last year and told me we would have really safe, highly effective vaccines against this virus, I would not have put any money on that. The fact that we do and that we're able to roll it out to the New Zealand population is just extraordinary. So I was really keen to get my vaccine to protect myself, but also my whānau, and also just part of being our effort as Team Aotearoa. It's just great to be in the position where we can offer such a safe, effective vaccine to everyone over 12 in New Zealand.
Nikki.
Yeah, kia ora. I'm a GP and I've seen too much sickness and infectious disease in my life. I can feel what COVID is like. I don't want it for my family, for myself, for New Zealand. So I have to vaccinate myself. I'd love to be protected personally, but also I don't want in any way to put my patients at risk. Don't want to put my elderly parents at risk. I don't want to put my kids at risk, those people that are on cancer drugs, those people whose immune systems aren't working so well. I'm not in this game alone. We've got to do it together. And I taitoku what Ashley said, that this is a really great vaccine. We've done really well with the science this time around. So it's good news for New Zealand that we got the vaccines before we got widespread COVID.
Vanisi?
Malolele. I must admit, initially, I was quite reluctant to get the vaccine, but after having seen the many deaths around the world, this affecting loved ones, children losing their parents. You know, I'm at the forefront and working as a GP. We see patients on a day-to-day basis, and I wasn't willing to take that risk or take COVID back home to my family. So I wanted to do this to protect my family, my children, our community, and our patients that we see every day. So please get vaccinated.
Well, kia ora tātou. So as we stand today, the goal today is 100,000 plus vaccinations. And as we stand, we have we have 62% of New Zealanders fully vaccinated, 83% with their first dose, and plenty more booked in. So I'm going to put the first question to you, Dr. Bloomfield, because it's about boosters, and so none of our questions are in any particular order, they're just as they're coming in. What about the booster shots? Originally, it was stated that it would be needed every 6 months after the second jab. Most frontline workers would be due for a booster shot now. So this person's concern is, are they still going to be covered?
Yeah, thanks. And I know there's a lot of interest in the whole booster shot, possibility. There are two things I want to say here. The first thing is the best way to protect everybody, including those who are already fully vaccinated and have been fully vaccinated for more than 6 months, is for us to get 2 doses into as many people as possible. That's what's going to protect our health workers, our border workers, our older people who got vaccinated early. So we've got to finish the job, and it's very important we do that first. On the science of boosters, well, the evidence is still coming in. There does appear to be some waning immunity over time, and we are watching that evidence, and we are preparing to be able to roll out a booster program from later this year. We need first Pfizer to actually ask for approval for a 3rd dose of the vaccine. That will be coming through in the next few weeks, and then we're standing ready. As soon as we've got that and we've got the advice from our technical advisory group, we will be ready to start offering booster doses to those who got vaccinated first.
Just following up on that question, a second question on that issue is someone who's working at the hospital in Christchurch who's had her second dose in May and wants to know, and you just touched on it, on the waning effect, will she be safe? What's the time frame that the government's looking at that at the booster?
So look, there are two things here. One is that we know immunocompromised people, those people who've had transplants or might be receiving treatment for cancer, they actually need a 3rd dose as part of their primary course. And so we're moving to be able to offer that, and there'll be announcements about that in the coming week. In terms of the timing of that 3rd dose, that booster dose, actually for the rest of the population, as I said, from later in the year, but the evidence is not that suddenly you don't have immunity after 6 months. There is just some evidence, and the studies vary on this actually, the ones that are already available, that immunity may start to wane. We're preparing to be able to give that booster dose, and the good thing is that with that 3rd dose, it seems people's immunity then does go right back up again, so that's great news.
Hi, Siouxsie, someone's asking you a question about if you've had COVID before, why would you have to get the vaccination?
Yeah, so if you get COVID and you recover, then obviously you do have some antibodies, and we've certainly got lots of data around the world that, not everybody who has had COVID gets COVID again. So clearly those antibodies are protective. But actually what the studies are showing is that if you get COVID and you get 1 dose of the vaccine, it gives you much better protection. So we think that will probably last longer. And again, that protection of, both people who are vulnerable, but also everyone around them is really, really important. The other thing that the studies are showing is that, quite a lot of people who get COVID end up with symptoms for a long time. It could be as many as a third. I mean, again, the studies are really different around the world. And what that's showing is that for some people, having 1 dose of the vaccine also helps with their long COVID symptoms. So I think it's also something for people to consider.
Nikki, this next person comes off the back of that and says, so if it doesn't stop it, if you can still get COVID after you've been vaccinated, why even get it? And stop calling us super spreaders, they say.
Yeah, well, the first question is the point of the vaccine is it dramatically reduces your risk of getting COVID. Absolutely. And so if you've been vaccinated, even with the Delta variant, you've got more than 90% chance of not ending up in hospital not being in intensive care and not dying. So that's pretty bloody good odds. I think the second thing is that a vaccinated person can still spread, but they can spread it at much lower rates. So this whole question about a super spreader is a bit of a loose word. Super spreading is about having a large inoculum of the virus and then pushing it out and spreading it to the community quite widely. So it's a bit of a mixed bag, that one. It's really clear, though, in all the data we've got that, vaccination is going to dramatically reduce that in all ways. But, it's never 100% perfect, because remember that the vaccination is working with our individual immune systems to get an immune response. There'll always be someone who doesn't get a really vigorous immune response. So that's why it's more a community question than an individual protection question.
Can I jump in here? Because I just want to talk about a study that appeared a few days ago from Sweden. So they looked at households to look at what was the chance of somebody who wasn't vaccinated in a household getting COVID if the people around them were vaccinated. So one thing we have to remember from the study is that in Sweden, the households will be smaller than ours. So I think that probably means that from their numbers, we'll need more people vaccinated. But what they found was they looked at something like 1.7 million people in 800,000 households. And if one person in that household was vaccinated, then the chances of the unvaccinated people getting COVID dropped by about 50%. If two people were vaccinated, it dropped by 90%. So that just shows how important this is, that, that being vaccinated protects those around us, especially in households where we know with Delta, if someone is infected, and they're in their household or their workplace, almost everybody then will become infected. So that just increases everybody else's chances of getting long COVID and all those kinds of things. And vaccinations, it's just incredible how effective they are.
It's a good segue to you, Vanisi, because when you consider that Māori and Pacifica, their populations 50% of them are under 30. Well, for Māori, the average age is 26. And so we've got this group of people who are actually well behind in vaccination rates. And I guess when they're looking around, it's not really affecting them. They're not ending up in hospital. They've got more of a chance. What are you hearing and telling your community?
Yeah, absolutely. And that's the biggest concern with our community is you need to kind of see the evidence in order to believe what's happening. And we're very lucky here in New Zealand, and amazing government who are able to contain this virus so that we don't actually have to go through all of that. I think it's evident with what we are seeing in the stats. Like with our Pacifica community, we can see our vaccination rates are slowly rising, and it's great. But since Tuesday, we've only had, 77% of our Pacific people that are eligible have been vaccinated with their first dose, and then we've got 53% who are fully vaccinated. And interestingly, going into specific ethnic groups, leading are our Fijian brothers and sisters who have 90% received their first dose and 71% fully vaccinated. And I think it's important for us as a Pacific community to look back and see what's happened in Fiji, because I think a lot of people have forgotten what's happened in Fiji. And there was a huge, the amount of people that suffered from COVID there, over 51,000 cases. And they also had a young baby as little as 2.5 months who died from COVID, and 663 deaths. And we can see now that they've got pretty much majority of their population, 97% have received their first dose, and the rates of the virus has actually reduced significantly, as well as the deaths. And so that's a perfect example of our own community, our people who are actually doing really well after being vaccinated. And I think it's just a matter of our people just seeing that. And yes, I know that a lot of our community have a lot of fear, and they have to be able to see that their own family members get vaccinated first before some of them. Like we've had some parents who have said that they've gone and had their first dose of vaccination to prove to their children that they will be okay. And once they've had their vaccination, that's when children are actually trusting in the vaccination or seeing their peers get vaccinated and coming out being fine after that as well.
Yeah, Vanisi, second question to you, we don't want to really have to learn from, watching other people suffer. And I see that in the last 2 weeks, the Māori infection rates really shot up from 14% to 26.9% yesterday of this current outbreak. What are you telling your people in your community, who are sitting on the fence?
Well, the other important thing is that our community are actually the most vulnerable, and that it is our people, the Māori and Pacific, who are the ones who are suffering from underlying health issues as well. And you would already see the stats that it's our people that are ending up in hospital with the Delta variant and suffering and in ICU and are really struggling. And with them having these underlying health issues like diabetes and heart disease, this is why we're trying to encourage them, because they're the ones that are going to end up passing this on to their family members and their elderly and everyone around them. So just like what we're trying to sort of say to our patients is just reminding them about their whānau, because that's important, and for us to be able to protect them as well, and just with our risk factors. And it is sad to see that majority of our people are the ones that are hit hard with this.
And maybe I could just come in there with, because there's a message of hope here as well. In the outbreak in Auckland, as Vanisi said, about 80% of our hospitalised people in the outbreak are Māori or Pacifica, and about 75% of the cases. But only 4% of our cases are fully vaccinated, and just 3 or 4 of those 170 people who have been admitted to hospital have been fully vaccinated. So here's the hopeful thing: the vaccine protects you. As Dr. Turner and Nikki said earlier on, it protects you from getting seriously unwell and ending up in hospital. And that's, if there's ever been as good a reason, and it's from our own communities, particularly there in South Auckland, in Manukau, that's the reason why people should go and get vaccinated, because it's the ticket to stop you from going to hospital.
Can you tell us those numbers again? Because I think they're so important, and I think that people miss them. So of the current outbreak, what percentage are vaccinated?
Yeah, so just 4% of our cases, over 1,800 cases, just 4% of those people who were fully immunised, actually. So it's 2 weeks since their second dose. And just 3 or 4 of our 173 people who've been admitted to hospital are people who were fully immunised. So most of our cases, most of the people in hospital, and again, 80% of those are Māori Pacifica. But the point here is, if you are vaccinated, it just greatly reduces your chances of getting the virus in the first place, and certainly absolutely helps prevent you from going to hospital or from dying from the virus.
Can you talk to us? Can I just check this one to Dr. Bloomfield? Can you then talk to us about why it's important that we make decisions in our family about all of our family? We've got people are really concerned about their 5 to 11-year-olds who can't be vaccinated. What's the best plan to combat that?
Well, this is the thing, isn't it? The best way to protect our children is for those of us who can be vaccinated to be vaccinated. And I think the data that, the information that Siouxsie was quoting earlier on from the study in Sweden is really compelling. We've seen our conversion rate. So if you get a case in a household here in this outbreak in Auckland, around 50% of other family members will become cases. But as the study showed from Sweden, if anyone in that household is vaccinated, it just reduces the chance of it going through the household. And that's particularly important for our tamariki who can't be vaccinated. And again, just looking at the data here, we've had quite a number of cases in this outbreak have been in children, and we've had 12 children under age, so 12 children and teens who have been admitted to hospital, and that can be avoided if the rest of us get vaccinated.
Yeah, we don't all live in large houses where we can self-isolate in certain rooms. We've got multi-generational people, families living together. Siouxsie, did you want to add to that?
Yeah, I just wanted, I guess, to sort of say that, it's perfectly understandable that certain communities are hesitant about this, right? They have every right to be. Systemic racism, all of those kinds of things. I think one statistic that people need to understand, so the Director General of the WHO said quite recently that 75% of the world's vaccines are going to the 10 richest countries. So, rich white people are hoarding them, right? That's how good these vaccines are. And I think that's a really, that gives us not only the data around how good they are, but the fact that countries are, grabbing hold of them. And so I'm really grateful to live in New Zealand, where we have these vaccine, a vaccine being rolled out to us, because there are people, really vulnerable people and healthcare workers all around the world who aren't, who don't have access and are probably not going to have access for quite some time still.
Amazing, kōrero. I just want to do some real quick answers here. Nikki, can you answer this one? Is it safe for youth to have 2 doses of the vaccine?
Yeah, so we do know that vaccines come with side effects, and we're aware of that. And all of us who have had previous vaccines know they come with sore arms, aches and pains, fevers. You feel really tired. Young people have a more vigorous immune system, so they get a more vigorous response, particularly after the second dose. So yeah, be ready to have some side effects, particularly after your second dose. We know that it's well quantified around the world. There are rare, serious adverse events that have been identified because the databases are identifying how effective the safety is. So we're all on the lookout to make sure you don't have an immediate allergic reaction, which is why everyone waits for their 15 minutes after the vaccination. And we are aware there are some other rare events, particularly this condition called myocarditis, which is an inflammation of the heart, which is actually very common after any old viral illness. It's actually quite common, and it's extremely common after COVID disease. And we do see it rarely with the vaccine. So these are the events that, the health services are out watching for to support people. So yeah, we do know that there's some things we need to watch out for, and, be aware that you can feel a bit lousy after your vaccine. I mean, I'm an older person and I still got a blimmin' sore arm and an aches and pains. So, you do have to be ready for that for a couple of days after you've had your vaccine.
Pineapple lump for you, because you answered 2 questions in one and you didn't even know it. So coming to you, Siouxsie, just quickly, should you let an unvaccinated person inside your house?
Look, I think this is going to be really difficult, right? And it's going to depend on what are your situations. What is the reason why somebody can't be vaccinated, and who is in your house, and are they vulnerable? If there are going to be people in my household who, would get really seriously ill from COVID, and I had somebody who was wanting to visit who had chosen not to get vaccinated, then I think that's a really different thing from, having somebody who hasn't been able to be vaccinated, for example, because they're allergic to the vaccine. We do know that that they're a small number. So we do know that actually this is really safe. It's safe if you're pregnant, it's safe if you're trying to get pregnant, it's safe if you're breastfeeding, safe if you're on cancer treatments, safe if you've got common allergies. But yeah, so it'll be an individual choice for families, but I know that I don't want people at risk around people who would have a really serious illness in my family.
Kapai, Dr. Bloomfield, are the 2 vaccines, first shot, second shot, the same? And what are the long-term effects?
Well, yeah, it's the same vaccine. So your first and second shot, minimum of 3 weeks apart. And that's what we've been doing right from the start. Long-term effects are very rare. As Nikki just said, we know there are these very rare side effects. And here's the really important thing. The side effects of the vaccine, including the ones that might be there like myocarditis, are way less common with the vaccine than they are with COVID infection. People get myocarditis 8 times more likely to have myocarditis if you've had COVID than if you've had the COVID vaccine.
Vanisi, Pacific Māori communities, I know this myself, more underlying health issues, diabetes, we've got kids with respiratory illnesses, had rheumatic fever and those things in your life. What is your advice in terms of, if people are concerned about that and having the vaccine?
Yeah, I think the biggest thing is that we know that this vaccine is very effective, and we know that it is safe. And we've already heard the stories of people who have suffered from COVID, and then also, like Siouxsie mentioned, the long COVID symptoms as well. And if we could just get that layer of protection, so that's all it is. The vaccination provides that layer of protection. It also stops you from having to get sick from COVID and end up in hospital. And it also it's able to just protect you and prevent you from having to go through all of that, because we've seen people die from COVID itself. And so in order to keep yourself protected, and also with these underlying health issues, that puts you more at risk. So just getting that vaccination will be able to help you and stop you from suffering from those long-term effects and effects of COVID.
Yeah, for myself, I've got to say I've had anaphylaxis a few times, and so I was a little bit nervous turning up there, but they looked after me, put me in a special room, made me stay later, kept calling my name out, embarrassing, but they really do look after you. So
that's the other important. as well is the vaccinators that are there, and the doctors and everyone, the health professionals that are all working together. Everyone's looking after their patients amazingly, and those that are hesitant, like I've seen my nurses just sit there and they're calming them down. They're finding some distractions for them. They're making them feel comfortable. Like, everyone's so loving and caring, and that's why we're all doing it, right? And we do this for our people because we do care for you, and we also care for your health as well. And it's nice to see that everyone's working together and coming together to do that for our people. Before
Dr. Bloomfield pops off, because he's got 5 minutes to go, I'm going to give you a question here. Grace asked if Novavax is an option, and if they don't want Pfizer, do we have it? Will we have it?
Yeah. So we've got purchase agreements in place for 4 different vaccines, and the one that Grace has mentioned, the Novavax one, there's a bit of interest around the globe. But here's the thing: the Novavax vaccine is still in trials. It's not been approved in any country yet. We will get an application to get it approved here. But let's contrast that with the Pfizer vaccine that's not only been proven to be highly effective and have a really good safety profile in the clinical trials. There are now hundreds of millions of people that have received this vaccine around the world, and we've got fabulous safety and effectiveness data on. So it's a tried and true vaccine. We do know that there are some people, though, who are just really wary of taking the Pfizer vaccine because it's an mRNA vaccine, and they're just concerned about that. But they would be willing to have one of the other vaccines. And so we're looking at, we've already got 2 that are approved, and again, 2 vaccines that have been used around the world, the AstraZeneca vaccine and the Janssen vaccine. So we're just looking at finalising arrangements to get one or other of those here in the country for those people who genuinely are happy to be vaccinated, but just don't want to have or can't have the Pfizer one. But for those who are hanging out for Novavax, it's a much slower track, and I'd take the bird in the hand rather than the 2 in the bush.
I'm going to come to Nikki shortly, but last one for you before you run off is there graphene oxide in the vaccination?
Oh, this is a really interesting one. What I should say is that a lot of the rumours around what's in the Pfizer vaccine are just things that often people put up as a joke. I mean, there's this one about, there was a TikTok done about the fact the vaccine was magnetic, and that this was due to graphene. Now, the thing about graphene is it is not magnetic. So even if it was graphene in the vaccine, it would not be magnetic. So, listen to what the experts say. Nikki's really good on the ingredients of the vaccine, so it's a good one for me to hand over to her. But, these are very, very safe vaccines.
Thank you, Dr. Bloomfield, for your time this morning. Kia pai tora, have a great time. Be safe, kia haumaru te noho.
Ka kite, ngā mihi.
Nikki, coming to you on that, you can add to that if you'd like, but someone wants to ask you a question about, they are trying to conceive at the moment. Is it safe for them to have the vaccine? And then perhaps you can continue talking about those who are pregnant, those who are breastfeeding.
Yeah, so there's nothing really to say on the graphene one. I think Ashley said it all. Kia ora. There is a bit of an echo chamber around there that somebody creates a myth and then it goes round and round and round in circles. And I think, Siouxsie reflected to us just at the start of this, that something like, I can't remember what you said, Siouxsie, but 2/3 to 3/4 of material come from very few sites in America that are just repeated and repeated. So remember that when you look at something that gets repeated and repeated and repeated, tends to create its own myth. No concerns about trying to fall pregnant at all. In fact, you'd want to be vaccinated. You certainly don't want COVID. So I'd encourage anyone who's trying to fall pregnant definitely to get vaccinated. We've got an awful lot of data around now about the effects of COVID disease on pregnancy. So don't wait would be my strong advice. There's no reason from a biological perspective, from a medical perspective, why this vaccine would have any problems at all. And the data is backing that up. So be very reassured. Remembering this vaccine is not live. There's no live virus in it. There's no piece of the virus in it. This is a vaccine where the body creates a protein itself to make the immunity. So very safe in pregnancy. I think the concerning thing for pregnant women is COVID disease. More and more, I think the world didn't realize that at the start. The early clinical trials left off pregnant women because they were more worried about older people and people with immune problems. And they missed the boat in the early days that pregnant women are at high risk of COVID. much higher risk than we thought at the start, both the women and their unborn babies. So I think now that we've got accumulated data, large amounts of data on the safety of the vaccine in pregnancy, now we know that we have got COVID in New Zealand community that's not going away. I would not delay. Earlier in the year, we were saying, let's wait and see, let the data accumulate. We have the data now. We feel confident about the safety profile in pregnancy. You know, for pregnant women, for your babies, don't delay. The other very cool thing about getting vaccinated in pregnancy is you make your own antibodies, you make your own immune response that crosses the placenta to the baby. So your baby will be born with some of the antibody protection from you. Same following through to breastfeeding. Breastfeeding's great for our babies. It's offering protection through our breast milk for our babies. Vaccinated women, again, would have antibodies that they're offering through the breast milk to babies. So you definitely go ahead.
While I've still got you there, Nikki, can I just ask you, someone wants to know, why is the second vaccination often sorer than the first?
Yeah, because from the first one, you've created an immune response. So your antibodies, your immune system's working away hard. And then when you do the second one, it's building on top of the first one. So that's probably why. Remembering though, everybody's slightly different. All our immune systems are not the same. You know, if you all get colds, you will end up acting towards the cold slightly differently. So some people get less reactions to their second dose. Some people don't get any at all. Doesn't mean the vaccine's not working. It just means you're in luck. So just remember, this is my immune response to the vaccine, and it's all slightly different from individual to individual. And that's individuals.
Jump in, please, Siouxsie.
I just wanted to put some numbers around this, the concerns that we have for pregnant people. So in the UK at the moment, 1 in 6 of the people in, critical care with COVID are unvaccinated and pregnant. 1 in 6. This is very, very serious. So pregnant people aren't at higher risk of getting COVID, but if they get COVID, the disease is much more serious. They're much more likely to have their baby early. So that's why it's so important that people get vaccinated at any stage of pregnancy, really.
Can I forgot to say thank you so much for our interpreters. So can we all just say thanks there, Jen and Kelly, kia ora. And coming to Vanisi now, some people have needle phobias, and how do they overcome this?
Yeah, we've had a few patients actually come in and have been quite reluctant to get it because of the needle phobias. But like I mentioned before, the nurses are so lovely and the vaccinators are so patient and they're able to distract them. And some of the ones that I guess the other important thing is just ensuring that our patients are well informed. And so we like to kind of give them as much information as we can before they come in to get their vaccinations done, making sure that they're comfortable and that they are happy to go ahead with it. But in terms of the needle phobia, after the nurses are so great at distracting them that once they've already given the vaccination, they're sitting there thinking, oh, was that it? Are you done already? So it's quick and easy and so fast. And I've had a lot of youth as well who have said, wow, all that hype for nothing. And is that all it was? I feel fine. So, people make such a big deal about, actually getting the needle put into your arm, but it's so quick and so easy. And our vaccinators are amazing.
Hey, Vanisi, can I back you up with a couple of anecdotes? A couple of anecdotes that our phone line has taken quite a few calls now of people who have said, I'm sure I'm not vaccinated. I went in, the vaccinator talked to me, and they said it was done. I'm not vaccinated, I want another one. I think that's a great reflection on our vaccinators.
Absolutely.
Vanisi, I was going to say many communities talking about, just having better immune systems and being able to not be vaccinated because they're taking their own rongoa, their own health products and stuff like that. What's your response to people who think that they can not get COVID by taking other alternatives? Yeah,
it's really difficult to speak on that. I mean, I know that there's a lot of traditional medicine for our people in our Māori community, but I mean, it's going back to evidence. Like Siouxsie and Nikki said, we've got so much evidence to prove that this vaccine is very effective. In terms of rongoa and other traditional medicines, I don't know how effective that is in, like, have we had much evidence to prove that that can protect you from getting COVID? I'm not too sure, and I can't speak of that, but I just know that the evidence that we have out there for the actual vaccinations itself is far more effective at protecting you and your family from getting COVID, as opposed to other things that that we're using.
I'll just clear this up and ask you to jump in here, Siouxsie. So, you know, obviously rongoa Māori is kumarahau and kawakawa, and they're fantastic things for fixing sores and the rest of it. And, you know, people are also talking about vitamin C and other vitamins. So, you know, are they effective, or do they work together?
So one of the things that's really tricky about these, about lots of medicines actually, is that so we have things that we know when you have really large amounts of them in the lab, you can kill something. But often when we take them, they're not in those kinds of concentrations, and they do work together, and they often actually work on the on our body's response. So it may well be that some of these medicines are actually quite effective at helping people with fevers and various things like that, but they're actually not antiviral. And so while you may feel a little better from having some of these things, what we know is that you obviously have to get infected first in order for them to be effective, right? And so unfortunately, the way COVID works is that people are infectious before they realize they're infected. And that's when you spread the virus. And so my real concern with people saying, you know, I have ways of, you know, either treating it or is that actually they won't stop transmission. And so, you know, that's why we know with the vaccines that actually they do a really good job of that. They do a really good job of stopping people getting infected at all. So, you know, it's just, yeah, it's a really, really tricky one. And we've also seen, you know, people, a lot of the things that people think are cures were things that worked initially, well, do work in the lab when you've got very large quantities of them. But actually, when these drugs were given to people in clinical trials, it turned out that they weren't actually effective. And yet people are still taking them around the world. Sometimes those are drugs that are needed for people with other conditions, and now they can't get the drugs that they need. So yeah, there's a tricky one. And I think prevention is always better than cure, right? Prevention stops people from getting sick, and that's what the vaccines are great at.
Nikki, can I just add? Sorry, I just wanted to add as well is it the other important thing with our Māori and Pacifica community is just embracing that hauora, and like, although, you know, like we do have our people who believe in their traditional medicine, like we don't completely disregard that, because I know that that's really important for our culture and our community to have that. But but in saying that, like, you know, it's really important that we embrace the spiritual, you know, our family and all of these te whare tapawha and like holistic sort of view on our health. And although, you know, we respect all of that, the vaccine is just that extra bit of protection that so, you know, like we're not completely disregarding everything else that's out there, but that the vaccine is just that extra bit of protection.
Can I just add as well, Vanisi, that these are not in opposition to each other, that, you know, for my immune system, my whānau's immune system to be as strong as possible requires all these holistic issues, better, you know, less stress, a better social environment, a better physical environment. You know, poverty really matters, lousy housing really matters, poor nutrition, they really, really matter. And I'm going to be healthier if I can fix those things. Alongside that, people still die of COVID, even the best we can do with our immune systems. So vaccinations are an extra tool, not a separate one alone tool. They're part of our holistic approach for us to keep us all healthy.
Yeah, Nikki, I was just going to say, I was talking with Dr. Henimore Elder this week, and she was saying if she could go back in time and take the vaccine back to 1918, when, you know, Māori were 8 times as likely to die from the flu epidemic, she would, because she said, you know, that while they were probably pretty healthy using rongoa Māori, that rongoa Māori just didn't have the antibodies to this infection. And so can you explain, or can you just, you know, reaffirm that if you would, that what the vaccine has in it that fights COVID?
Yeah, so remembering that the world has never seen COVID before. So we're like a new community where measles is just common to it, or flu has just arrived for the first time. with colds and flus and other respiratory illnesses from infancy. We've been exposed to them, or we've had vaccines in infancy, so we've had immunity. Suddenly, overnight, this new virus, nobody has got any immunity to it all. So all our natural ways of looking after ourselves are really important so we can fight it, but we actually have no immune memory at all. So that's the importance of a vaccine, very similar to what we do for childhood vaccines now, so that then we're prepared. And when going forward, we see COVID, we now have some immune protection, very similar to 1918 when people didn't have a lot of immunity to flu. And so very different position then when we didn't have these powerful, modern, very pure vaccines. Now, there was a second part to that question, wasn't there?
No, that's fine. We'll go to Siouxsie because everyone wants to know about long COVID. I've got, I was on the board at Marist when we were the first cluster back. I can't even remember when that was now. So I know quite a few people have had COVID. So I've got a niece who's got long COVID. It just got rung up by one of the parents last week who's been in hospital again with heart issues, which are related to his long COVID. Can you talk to us? What is long COVID, and why? And is it any different to like China, recovering from the flu?
So what we know for for some infections is that there are long-term consequences, or there are complications that happen late in life. So a really good example of this obviously is strep and rheumatic fever and rheumatic heart disease, right? So this is basically a response that happens to your body and then kind of keeps happening. So the research on long COVID is not where it needs to be. It's certainly not where it needs to be in New Zealand. We need really now help for the people who are getting it. But we're starting to get information from other countries. And at the moment, it looks like there are kind of possibly 3 different types of long COVID, but there are about 50 symptoms in total that people can have, and varying degrees. Some people might only have 1 or 2, and they might come in waves. Others are actually debilitated for months and months and months. And the common things are fatigue and what people call brain fog, so finding it very difficult to concentrate. But others have this impact on their heart, so kind of a racing heart. Some people have had to have pacemakers installed. People are told not to exercise anymore. So it very much depends on the individual, and we don't yet really understand why and who's most at risk and which form they're likely to get. So it is a really tricky thing. I'm hopeful that it will be studied. It certainly is going to have to be, because around the world there are millions and millions of people now with long COVID. What I'm worried about is also that this is still quite short term. And so what might the long-term effects be? If people are suffering from fatigue or depression or any of these kinds of things, brain effects, does that put them more at risk of other things like dementia and stuff? And we won't know that for a long time, which again is why we go back to why we want to prevent it in the first place, which is vaccines. Do you think it would be helpful to talk through what's in the vaccines and how they work, or what's in the Pfizer vaccine and how it works?
Sure.
I can do that. So there, because we kind of heard this with, so there's some wacky ideas about what's inside it. It's really, really simple. There are some sort of complicated chemical names, but frankly, an apple is full of complicated chemicals, right? So the ingredients are basically the recipe to make the spike protein of the virus. And this recipe is called mRNA, and it's very, very fragile. And there's a very small amount of it. So 30 micrograms, it's weeny, weeny. And as I said, it's really fragile. So in order to protect it, we basically, we stick it inside little balls of fat. And those little balls of fat are actually a really cool way of delivering lots of medicine. So that's a technology we know really, really well. And then when you inject anything into the body, if it's not at the right pH, it can make our cells kind of burst. So in order to make it at the right pH, we add salt. And then because it's really fragile and so we keep it at low temperatures, in order to protect the little balls of fat, we add sugar. So the ingredients are sugar, salts, fats, and this little recipe to make this the spike protein. And the way it works is taking advantage of a process that happens in our cells every single day. So think of us as little protein producing factories. And the recipe in our cells that make proteins comes in our DNA. But our DNA is very precious to us. And so we kind of lock that away in a little special part of our cell called the nucleus. So in order for our cell to make proteins itself, what happens is the DNA gets, basically the recipes get written down in what we call mRNA, and that moves out of the nucleus and then goes to these little machines called ribosomes that make proteins. And so what we're doing with this vaccine is just delivering the mRNA, this little recipe to say to our cells, instead of making human cells for a bit, can you please make this, this protein instead? So that's exactly what they do. But the cells are really clever. So they quickly realize this is not a human protein, this is a viral protein, and they basically chop it up and then they show it to the body. And you know how I said that mRNA is really fragile? Well, then it just basically breaks apart. So it probably only lasts a couple of hours or maybe a couple of days at most, and then it's kind of gone. Your cell has done what we needed it to do, and it's basically shown the immune system this protein that's basically like the detailed dossier of this virus saying, you know, this is what we need you to protect us from in future.
Kia ora. And if that was over your head, then Siouxsie's going to make a cartoon series to explain that. Or she's probably already done one, so check that out at the spin-off. Vanisi, just back on the long COVID, because we don't know, as Siouxsie said, you know, it's very short. What we are hearing is headaches and, you know, breathing difficulties and stuff. And actually, I did an interview with the Te Heko whānau who lost 2 people in Tokoroa in last year's infection, and they still have family members now that have to use breathing apparatus at night just to sleep as long COVID. Given the underlying the health inequities in the Pacifica Māori communities, do you have some concerns about what, you know, long COVID could be different for your people, our people?
Yeah, absolutely. I think what I just wanted to reiterate is that with the long COVID as well, like these are people who haven't been vaccinated. So these are our unvaccinated people who are basically getting COVID, and even those that are developing mild symptoms as well are ending up with these long-term effects. So not straight away, but down the track, they're developing these effects from the COVID that they initially had. And that's something really important to know, comparing those that are vaccinated to those that are unvaccinated. Getting COVID, although people are surviving, because a lot of people are talking about, oh, but the survival rate is so high, like why should I get vaccinated? But those that are actually ending up with COVID are really suffering from these long-term effects, what we call long COVID, like Siouxsie had talked about. And I worry about our community. They're already suffering from underlying health issues. And to have long COVID on top of that, like that's detrimental to your physical health, your mental health, and the effects that can have on you and your whānau. And, you know, our people are already working long hours, like working a number of jobs to feed their family. Like we're already disproportionately, you know, like we compared to all the rest of our general population. And so we don't need this COVID on top of everything that we're already suffering from. And I've seen also young kids, young, otherwise fit, healthy, a guy in Australia who talked about him suffering for 18 months of long COVID, fatigue, also headaches and all these symptoms that and shortness of breath and all these ongoing symptoms that he just continuously is suffering from, and he's not even back to his baseline. He can't go back and play sports. And is this what our people want? No, we don't want that. And in order to prevent this from happening, getting the vaccine would be what will stop you from getting this long COVID.
Excuse me, jumping in briefly to support you. There's a meta-analysis just out within the last week, which is an analysis of all the analyses around the world, showing that of people who have had COVID, more than 50% still have some sort of symptom problems 6 months later. That's so frightening.
Nikki, I wondered if you could shed some. I wonder if you could shed some light for us. You know, we often hear that people have gone to hospital. We hear about hospitalization, but you know, what is it like when you're in ICU? What does that mean?
It's very hard to describe to somebody who's not been with somebody in ICU. It's very terrifying. You've got a lot of tubes in you. People have no idea what's going on. You're getting a huge amount of medications pumped into you to keep your body going. Many people can't breathe by themselves. The problem with COVID is that sense that you can't take in a breath of air. I don't want to frighten people. You know, we have a way of stopping that happening here. But, you know, to visually see people struggling in ICU and to be a family member sitting and watching someone, it's overwhelming. I don't actually know how to put this in words. And, you know, I just want to reflect that it makes such a difference not to have to live alongside that. I've seen people die. I've seen people die of polio, of measles, of preventable diseases. You know, it doesn't need to happen for our whānau, or it will happen, but really rarely, not commonly. So it's just hard to share the pain.
Yeah, no, the purpose of that was not to frighten anyone. It was to just give people a picture of what happens. We don't often hear what happens after people go into MIQ, and if you know somebody who's been through it, sometimes you do get a bit of an insight in there. But Siouxsie, jump in here.
Yeah, there's one thing we haven't talked about, and we don't tend to talk about this one a lot. So we've talked about long COVID and we've talked about serious COVID. The thing that's starting to be reported by doctors now are what we call sexual dysfunction. So there are people who after COVID, and we don't yet know how many there are because it's something that people are not talking about, but who struggle to get an erection, who suffer from premature ejaculation or aren't able to ejaculate at all. So that's just another part, I think, that may well end up growing in number. You know, that those kinds of things are going to impact on very much on people's well-being, but also on their future fertility. So again, that's something we really don't want people getting, COVID for those reasons too.
Do you think, this is a question for whoever wants to answer it, it's on here, is what does the future look like? Will we be wearing masks forever?
If we can't keep COVID as low as possible, I'd like us to get to the stage where we can treat it like measles. Like when an outbreak happens, it's like, vroom, you get on it, contact trace, stop it. That we do everything, we use every tool in our toolbox to keep cases down to practically zero. It's going to be really, really hard. And so things like masks, things like vaccination, but things like also not using things like these vaccine passports, right? Being able to say, well, actually at a big event, the chances of if somebody has COVID, if we've got unprotected people here, that's going to be really high. So the future may well be what it looks like. It may well look like masks and all of these kinds of things. And and that has detrimental effects for other parts of our community, right? For our deaf community and things like that. So my preference is that we do everything we can to keep COVID at bay. And vaccination is one of those really
I can add a little bit. I mean, I think that, I would see it more in the long term, possibly like influenza, that as we get a highly vaccinated population and as we have small amounts of COVID coming and going within the New Zealand community, we will boost our immune response. We will no longer be that naive community that has never seen it because we've seen it mostly through vaccination. So then we will have a degree of protection and we will be able slowly over time to lift a lot of our public health protection mechanisms, although we'll still need them in patches here and there as it breaks out. So, we will change. We will be able to get back to a different lifestyle, which was what we had before, but it will take time as we get our protective immunity up. And at this stage, the majority of that is absolutely going to be through vaccination.
I
was just going to add to that as well. And that's the important thing. Like, although this may seem, it's the uncertainty. And although this may seem that this is probably actually going to be our maybe normal or near normal, that the reason why we're pushing for the vaccine is because the longer we wait, the longer we're going to still stay in lockdowns, the longer we are not going to go back to normal, and the longer we're not going to have a normal summer and our kids go back to school and live their normal lives. And I think that's what we have to remember, is that we really are trying to push for everyone to get vaccinated so we can try and get back to normality, so we can be able to go there and just be normal again. Because I'm sure just as much as we are sick of being in lockdowns, everyone else is sick of being in lockdowns as well. But like all the other vaccinations, once you've got such a high number, the more people we have vaccinated, the more herd immunity, the more protection we have in the community, and the more we can just walk around. And yes, there'll probably be a bit of COVID here and there, but then at least we are confident knowing that we're not going to end up in hospital with severe disease, end up in ICU, or end up dying from COVID, because we know that we've been protected and that we're not going to be passing on the COVID to each other. So I think it's so important. The sooner we all get vaccinated, the sooner we do this, the sooner we can go back to normal, please, before summer.
Kia ora, kia ora. Thank you so much. And I just can't believe how many questions there are about the magnet. And once again, in case you missed the beginning of our kōrero, it's impossible. There is no graphene oxide in the vaccine, and TikTok is amazing for creating new themes and amazing things. So yeah, that's not a thing. So I'm answering that for multiple questions that have come through. I want to thank you for coming today. I want to thank our panelists, our interpreters, everyone who's tuned in. I hope the information that we've given you to the questions has helped you be more informed about your decision. And if you are thinking about being vaccinated, there are sites all around the country. Just go on to Unite Against COVID on all the Ministry of Health's website and click onto your region, and you'll find lots of fun things that are happening there. Mā tātou, mā koutou, mā rātou, let's do this for each other. Let's give it our best shot. Mauri ora, kia tātou.